The foster program is a critical part of our ability to save and adopt out so many kittens every year. Kittens under 8 weeks of age are at the most at-risk population in our shelter. The shelter environment is very stressful, and removing an animal from this environment lessens their potential exposure to illness or disease. What kittens need to be fostered? Kittens that are less than 8 weeks of age and under 2 pounds. Kittens under 4 weeks old without a mom and need to be bottle fed. Nursing moms with litters. Kittens or cats recovering from an illness or surgery, or kittens that need to be socialized. Caring for bottle-fed kittens. When you are bottle feeding a kitten, here are some very important tips. Never feed a kitten that is chilled. Never feed them any cow's or goat's milk. Only feed them KMR, which is a specially formulated kitten formula. Make sure you gather everything you need before you begin the feeding process. You want to properly position the kitten. It's important to never place them on their back, as the formula can aspirate into their lungs and cause pneumonia or even death. Allow the kitten to suckle at its own pace. Keep the bottle at a 45-degree angle for the kitten to swallow freely. Foster rechecks. Foster rechecks for kittens less than 4 weeks of age are seen weekly. After that, they are seen at 4, 6, and 8 weeks. At 6 weeks of age, they are tested for FIV and FELV. They receive their first vaccine and their first dose of Frontline, which is a flea preventative. At 8 weeks, if they're over 2 pounds, they will stay, receive their second booster vaccine, get spayed or neutered, and then will be placed up for adoption. It is important to bring a fecal sample each time you come for rechecks, unless you were told otherwise, so we can screen for intestinal parasites. Any recheck for adult cats will depend on their medical need. Dealing with an upper respiratory infection. URIs are similar to common colds in humans. The signs of a URI is sneezing, runny nose or congestion, red, swollen or runny eyes, squinting, coughing or hard swallowing, fever, lack of appetite, hiding, and or decreased energy. URIs are treated with oral liquid antibiotics for 14 days and also an antibiotic eye ointment if it's necessary. They will need to be isolated from personal cats or kittens. Also, please be sure they are eating. If they have a stuffy nose, they can't smell their food well. Diarrhea in kittens. There's a good chance that kittens will get diarrhea at some point. Their digestive systems are very sensitive. If they do, it could be a sign of stress, infection, parasites, or dietary changes. It is important that while they have diarrhea, to make sure that they do not become dehydrated. When you start to see the soft, mushy stool, you should start them on canned pureed pumpkin. Give them about a half of a measuring teaspoonful per kitten at each feeding, and then contact our foster care coordinator to schedule a time to bring in a fecal sample so we can look for parasites. Kittens with diarrhea cannot always control their bowels and will sometimes go wherever they are. This is messy and a very good reason to keep them in a bathroom or space where there is no carpeting for easy disinfecting. Dealing with fleas. Most kittens are found outside, and we live in Florida, so there are a lot of fleas. We look for fleas on intake. If they have an infestation, we will give them a bath and a Capstar. Kittens that are at least 1.5 pounds are given Frontline 24 hours after the bath. If you find fleas at home, give the kittens a bath using Dawn Original Dish Detergent or 7th Generation Free and Clear. Also, frequently use a flea comb. Dealing with parasites. Common intestinal parasites in kittens are roundworms, hookworms, and coccidia. It is possible for kittens to get them from their mothers, and most of the kittens brought here have been found outdoors, so parasites are not uncommon. We treat kittens upon intake with a medication for coccidia and a medication for round and hookworms. We also put them on a probiotic called Fortiflora. You may be going home with at least 2 of these medications. Bringing home kittens. When bringing kittens into your home, there are several things to keep in mind. First, make sure you have a suitable place for them to stay. A bathroom works well. This space needs to be temperature controlled and can be disinfected with a mild bleach solution, which is 1 part bleach to 32 parts water. It should also be able to withstand kitty messes from litter box accidents, spilled water, food, and etc. Make sure your designated space has no breakable items, no small items they can chew on or swallow, and make sure the toilet lid stays closed if they are in the bathroom. Your personal cats must be spayed or neutered and up to date on all vaccines, and your personal pets should be kept in a separate area for health and safety reasons. Feeding kittens. When feeding kittens, please use stainless steel or ceramic, as they are easy to clean, as plastic is porous and can harbor bacteria. Kittens are growing and require good quality food and nutrition, preferably kitten pate food. They must have access to food and water 24/7, as they are very active and burning a lot of calories. A good rule of thumb is to feed canned food 2 to 3 times a day and have a bowl of dry food and a bowl of water always available. Kittens in litter boxes. Kittens are easy to potty train. Just plop them in the box and they're trained. If you are having issues using the litter box, have more than 1 box and be sure to keep them all clean. Please don't use any clumping litter. We recommend that you use clay litter only or pine bedding found at feed stores. Also, please be sure their litter box is not close to food and water dishes. Socialization. For the first 12 weeks, kittens become socialized towards other cats. They learn appropriate respect toward adult cats from their mothers and how to get along with peers from their litter mates. They learn where they stand in hierarchy, to respect other cats' territory, and how to fight fair. During their first 12 weeks, they learn who's safe and who's trustworthy. To become socialized and friendly with people, this is an important time for loving human hands to hold them, pet them, and play with them. Redirect aggressive play with your hands, fingers, or feet towards a toy so they don't get the habit of biting and scratching people, because it's not cute when they're adults. Fostering is an immensely rewarding experience that saves thousands of lives in our community each year, and we couldn't do it without foster volunteers. It changes animals' lives in a very direct way. Thank you for your interest in becoming a foster parent for Pet Alliance of Greater Orlando.